Thank you, sir. How are you? Good evening, everybody.
Good evening.
So today we're going to talk a little bit about lifting your body. Okay. We're going to go over general procedures that we can use to try to replace or rejuvenate areas in the body that through aging process they have gone and lost some of the youthful appearance of the areas of the body. That will include the trunk. We're going to talk a little bit about breast, torso. We're going to talk about thighs, arms, and use of liposuction as well. So it's going to be a little bit of all over the place, okay? Something that I want for you to do is then at the end we're going to talk a little bit more about what are your questions. There may be things here that I won't be able to cover, and then we can talk more in detail depending on what you guys think.
Before you get started, Jacqueline, can you just give them just a quick understanding of the promo that's actually going on for the guys that actually came out? So we want to just keep those in mind. I skipped over that part. This is Jacqueline, my event plan and marketing director, all that good stuff. So I'm going to turn it over to her real quick.
Tonight the promotion is $500 off any surgery paid in full tonight. So anything that he lets you know about tonight, if you pay in full, you get $500 off.
You can make consultations downstairs after. And essentially for those who actually will wind up, is there anything if they come to the seminar and wind up booking during their consultation? If it is, we'll let you know for the consultation. My office manager, come on in, join the party.
So this is what we're going to talk in the program tonight. We're going to talk a little bit about doing breast lifts and reductions, as well as we're going to talk about trunk procedures to enhance the appearance of the trunk. And last but not least, we'll go over the extremity procedures. And then finally, we'll go over a question and answer session. So first, let's talk a little bit about the breast aesthetics. I try to explain the concept of aesthetics with a hand. Okay, so a hand has 5 fingers, it has nails, and the 4 fingers are up straight with an opposing thumb. This is the normal appearance that we find normal. Occasionally within time, something like an injury on the hand, you may go and stick your hand on the lawnmower that is running, and all of a sudden you lose a finger. That's not an aesthetic hand. So we're going to talk first about the aesthetic portion. Then cosmetic means that we're going to enhance something that is already present. Okay, and we're going to talk about what makes a breast beautiful, which is in terms of volume, shape, the skin of the breast, and the curves of the breast, and finally the nipple areolar complex. So it's a picture more or less of what we consider a beautiful breast. Okay, it has a slant on the top, nice full bottom curve with 55% distribution of the volume below that midline, and then the nipple is facing forward or slightly up, and that's what we consider a beautiful breast. So by doing some surgical intervention, sometimes we may be able to restore the volume and try to give it a more nicer appearance. For example, this is most likely a breast that have been a postpartum breast, and due to the breastfeeding and all the normal functions of the breast, it have lost some of the volume that make it look nicer. So just by replacing some of the volume, we can actually recreate those things that we just mentioned before to make it a little bit more beautiful. So within the same strategy, sometimes the volume is really large of the breast and it's too excessive, and it also causes some other problems, like including rashes, breakdowns of the skin, problems with shoulder pain, numbness of the fingertips. All those things can be secondary to too large of a breast volume. And with that in matter too, you lose all the normal distribution of what we consider a good aesthetic or cosmetic breast. So we can actually reduce the breast or actually try to lift the position on the breast in order to enhance the appearance of the breast. Okay, this can be done through a multitude of incisions. Okay, so a lot of people come, am I gonna have too many scars or things like that? It all depends on how much the breasts have dropped, how much we have to resect. Sometimes it's too much skin, and there's no way that we cannot do this without scar. But we always try to minimize the amounts of scars. Sometimes we can use the excess tissue in somebody that have a lot of dropping of the breast, and use all that skin, take out the outer layer, and use it to auto-augment the breast and without having to put an implant on the patient. Also, I always like to bring this because we don't think about men. Sometimes as we age, our breasts start losing or gaining too much fullness, and then at that time we can actually do surgical interventions in order to try to reduce the volume of the male breast, okay? Things like inverted nipple or the size of the areola sometimes can be displeasing, and we can try to do other surgical interventions in order to release the nipples, so nipples that are tucked in. It's nothing abnormal, it's that it's tethered by the gland, but sometimes by releasing the ducts we can actually reestablish a normal nipple appearance or areolas that are too large in diameter or the person is unsatisfied. There's nothing wrong with them, but they are not happy with how they look. We can actually make them a little bit smaller. So talking more about reduction, these are some before and after pictures. If you see the light it cannot demonstrate here, but actually the umbilicus of this patient, you can see it here, and the breast is almost at the level of the umbilicus. So this patient had a lift and reduction at the same time. Usually they can be a little bit square at the end. With time that resolves, but then the overall volume is reduced, but it still have the pleasing aesthetics by having the nipple in the forward-facing position at the right level. Again, this is a patient with really, really large breasts. He was complaining of a lot, shoulder pain. You can actually see the bra indentation with time can actually cause some problems with that. Patients are constantly complaining of upper back pain and shoulder pain because in order to sustain the breast in a normal position, they have to wear these really heavy bras that cause some of that indentation. By taking it easy, about half a liter to a liter volume of each breast, usually these patients are completely relieved of their pain, and they can also go and lose weight because then they feel more relief of the pain. They can go and be more active. They can do a lot of fitness without having to wear 4 or 5 compressive bras. So all those things improve the overall health of the patient. So now we're going to jump a little bit about the trunk procedures, things that we can do to enhance the trunk. A lot of times some patients come and ask me, can I have a tummy tuck? And all of a sudden we examine the patient and there's not a need for that because all the skin and the muscles of the abdominal wall are in good quality, so the only thing we may be able to do is liposuction. Or sometimes patients are a little bit on the heavy end and they ask me, can we do liposuction to lose weight? Well, liposuction is not made to lose weight. It's actually to enhance the curves of some patients. So they may benefit from some other type of procedures, and we're going to discuss a little bit about them in a second, okay? So we're going to go over liposuction, butt lift, or gluteal enhancement, okay? We're going to talk about tummy tuck, and last but not least, body lift. So, like I was saying, liposuction is more of a liposculpture. Sometimes we get the narrow jeans that cause the muffin top. Well, sometimes we can target those muffin tops by liposuction. It's a little bit of adiposity on the flank. And by just removing that little big excess fat, you can actually recreate the hourglass shape of the body and then enhance the appearance without having to do any further in terms of surgical intervention. Occasionally the saddle bags, as we start getting older, fat deposition migrate from one side to the other, so we can start creating what we call the saddle bags, and we can get rid of them and kind of have a better shape on the thighs as well, okay? So we'll talk a little bit about the steps of the liposuction and the technical adjuncts that we can do in order to make the procedure better. Over here we actually do an ultrasound assisted liposuction. We'll discuss a little bit more in a second about that, okay? So again, liposuction will use suction to remove stubborn fat. Sometimes people tell me, but this is not surgery, is this easy, is this not gonna hurt? Well, liposuction is still surgery. We have to introduce some cannulas under the skin that are going to be able to mobilize the fat and suck all that excess fat, and when that happens, it actually causes injury under the skin. So it's going to be a little bit of pain associated with that. It is a surgery. There can be complications. That's why we undergo a significant amount of training in order to provide this safely, but it still can be a risky procedure. So the patients have to be good candidates. They have to be in an overall good state of health. They cannot be having problems with their blood pressure, with diabetes, with history of heart problems. All these things have to be in consideration. Sometimes they may be able to have some of these things optimized by the primary care physician, and if that's the case, then at that time we may be able to proceed. It all depends on a case-by-case basis. So again, we're contouring and sculpting the areas. In the United States, about 300,000 liposuctions get done, which each year very safely. Occasionally we have somebody in the news about somebody having a untoward outcome, like any surgery, something bad happened. We try to make everything as safe as we can, and we usually do really well over here. What has been the major breakthrough for liposuction has been the use of tumescent solution. This is a solution that has local anesthetic on it. It has some of the medications that cause shrinking of the blood vessels, so it will decrease the amount of blood loss, so the pain is under control, and it actually causes protection of the skin as well as the abdominal wall muscles when you do the liposuction, okay? So we place a protective fluid under the skin and above the muscles of the abdominal wall, or if we're doing it on the thighs or the arm, it's in the same layer, different thickness as we move throughout the body. And then the second stage is to use some technical adjuncts, okay? We can use laser, that's smart lipo for the people that have Googled that before. Over here you use ultrasound-assisted liposuction, which use, this is not the ultrasound for mom babies. It's a cannula that moves at ultrasonic speed, and it goes blasting the fat, and it actually makes it all nice and buttery. So then it's very easy to suck out. When it happens, it actually causes a little bit of tightening of the skin by inducing some growth factors from the undersurface of the skin, and it actually causes some of that skin to redrape and tighten as we actually use that technique. And then the last but not least is using the suction, and something very important at the end is actually, like Dr. Dickerson was talking about, the wear of compressive garments. These garments allow your skin to redrape back to your torso and keep the skin back in the position as it heals, okay? And this is what we're talking about. Other adjuncts are laser. That's when we actually put a laser cannula under the skin instead of an ultrasound, and this laser cannula goes blasting the cells, okay? So it does similar effects, but at the same time, I think I like more the ultrasound. I actually have better control, and I can actually feel it when that happens. With the laser, it just goes blasting, and I cannot tell where it blasts. So, but it's usually very safe as well. It's about 1 centimeter away from the cannula. Last but not least is a power handle, and it actually is a handle that attaches to the cannula, and it goes rolling back and forward and take out fat. Most of the time I just use my strong arm to take care of that. Okay? Within the same line, we're going to talk a little bit about the Brazilian butt lift. That's something that has been coined out there. It's nothing more than using the fat that we actually have aspirated, process it in a special fashion, separate the excess fluid and oil from the broken cell, and whatever cells are there that are alive, we can actually transfer it from one place to another. Mainly right now, and it's very common, and I've been doing a few over here with excellent results, is actually using the skin from the love handles and then preparing the fat and transferring to the gluteal region. And then you end up having a better defined waist and enhanced buttocks by the time it's completed, okay? Some of that, it looks fantastic within the first few months because it's huge, but then some of that it gets lost, okay? Yeah. A lot of people is like, oh, I want to keep it. Yeah. No. Some of that is going to go away, but a lot of it remains enough to actually have a satisfactory contour of the buttocks, okay? Next, we're going to talk a little bit now about the tummy tucks and what are the tummy tucks and which patients are good at it, are good candidates for it, what makes an abdomen beautiful, and how we can actually, using some surgical techniques, recreate that, okay? And then we'll talk about the different abdominal surgeries and pre-op and post-operative photos. So the abdominal aesthetics, as well as the breast, we find certain aesthetics on the abdomen attractive. So when we see somebody with a nice torso at the beach, it's like, that is a pretty abdomen, okay? And things that enhance that is actually the shape of the abdomen. Usually we don't like to see squares, more of an hourglass waist actually. We find attractive the quality of the skin, okay? Also curves in the top of the ribs and at the bottom on the iliac crest, which recreate the hips, okay? And last but not least, the belly button, okay? Depending on the culture, certain types of belly button are found more attractive. So the right position and the hooding of the belly button, all those things define what we consider a beautiful belly button. So again, shape, curves on the ribs, curves on the hips, the position of the belly button, and usually we like for it to be flat and tightened, okay? So when we do cosmetic abdominal surgery, we try to recreate those things. Usually what happens, especially after childbearing, a lot of stretch marks are developed in the lower part of the abdomen. The six-pack muscles, all the sudden separated, and one three-pack go one way and the other three-pack go one way, okay? And then after the baby comes out, then it doesn't want to come together at the center. So we're going to try to recreate that and try to put the six-pack back together, okay? And then tighten the abdominal wall muscles and get rid of all that stretch mark skin. Sometimes when we do this as well, we create a mons lift, because sometimes as aging comes apart, the mons, which is the upper part of the vulvar region, actually descends down, and we actually kind of give it a little lift as well when we do the procedure, okay? Don't.
That's your hoo-hoo is lifted up.
Yeah.
Yes.
Yeah. We got it.
The who. So this is an intraoperative picture. It may look a little bit gross, but let's actually keep track on what we're looking at. So this is actually one of the six-pack muscle. I actually have put a little mark along the length where it have been separated. This is the native belly button that we're gonna use to recreate a new belly button. And what we're gonna do is actually tighten those muscles to create flattening. And all this is just excess skin that's gonna come out once the tightening of the muscle have been done, okay? So this is after the muscles have been tightened with sutures, okay? The belly button is still there, but now the abdomen is very tight and flat. Ooh, we're having problems with lighting. But this is a patient that had several children, and she had excess loose abdominal skin, a lot of stretch mark, that overhang, and at the end, actually, her curves were enhanced with the surgery. The scar is over here, very thin. I wish we had a better lighting. This is another patient of mine that we did the same thing again. A lot of excess loose skin at the lower aspect, stretch marks, belly button have lost a normal contour. There's bulging of the abdominal wall as well. We're able to recreate and enhance the abdomen, put some flatness, recreate the belly button where it has to be, okay? And it actually had a little bit of a lift as well, okay? When we talk about body lift, these ones are gonna be quick slides because it's, they are not same procedures. Different patients will be candidates for this, but what it is more of the skin resection. So a body lift would be good for a candidate that not only has that excess skin on the abdomen, most of the time it's secondary to massive weight loss or again childbearing. And then when they lose a lot of weight, they actually lose weight in the buttocks, okay? And then all of a sudden they start hanging down and sagging. So at that time, those patients are good to make the tummy tuck part, and as well, you can continue the excision of skin to the back and help raise the buttock and get rid of all that upper excess fat. So this will be a complete or body lift when you hear that word, okay? Other lifting procedures, a very common one that we do is also arm lifts, okay? As you continue to age, the elastin on the skin continue to diminish in amount, and the collagen and all those qualities of youthful skin are starting to disappear. Yeah, let's see if we can turn the front lights down. Now it's gonna be too dark. Oh,
That's perfect now.
good. So now you can actually see this actually patient has a scar that goes all the way from the axilla all the way to the elbow, okay? So you're gonna have a scar. You're trading something for something. You're gonna get better contour of the arm and everything, but you're gonna have a scar. Usually the scars of brachioplasties can be a little bit unsightly, dark and everything, but my goal when I do the surgery is putting that in the bag. Because when you walk away, people don't look at your back, or when they do, they don't look at your arms, okay? So, yes. I didn't say it, it was you. Last but not least, we're gonna talk a little bit about the thigh lift. The thigh lift is the same intervention, but done for the skin of the thighs. Excess amount of skin now after massive weight loss is stay between the legs, and then this actually causes a lot of discomfort with the patients trying to do fitness. You know, they go to the gym, and even though they have lost a significant amount of weight, then they go to the gym and they have all this skin that it goes and sag back and forward while they're trying to jog. I have seen marathon runners and they're like, I can't take it anymore, do something for me. And then once we take out the skin, we can actually not only take out the skin that goes excess all the way down to the thigh, then we can actually lift it up into the groin, and then the patients now don't have all that excess the uncomfortable skin. Some of them feel like they came out of a horse and they've been walking with separate thighs for a little while until they get used to not having all that skin in there. Okay? And this is the end of my talk. Any questions?